What is sciatica? Hey guys, it's Dr. Walt from Pinecrest Chiropractic. Let's talk about that. This is one of the things that we see the most often in our office, just about every single day. And there's a bunch of different causes for it. And oftentimes people have misunderstandings of what actually is sciatica. So let's start with the base. What is it? Well, your sciatic nerve is a nerve that comes from the low back and it goes all the way down the back of the leg. And this innervates lots of different muscles, lots of different parts of your tissue and your skin, and provides a lot of the information about your leg back to your brain. Well, those nerve roots start all the way up at L4, all the way down to S3. So these 5 nerve roots that come out from the side here, they come together and they bundle, and then they go across your SI joint and then down your leg. Now, getting pinched any single one of those nerve roots can create this type of sciatica sensation. Sciatica just means it's inflamed, it's angry. And so that sciatic nerve is angry, and it can come from the nerve roots like we just said. It can also come from things later on down the leg, right? So it can be something in the SI joint. It crosses right around your piriformis, so a hypertonic or really tight piriformis can create those issues as well. So lots of different things can cause it. When we zoom in on the nerve roots, the different issues that can cause it there could be things like, this tries to give an example of a disc herniation, or we have different little models that show that as well, right? So these disc herniations are when the disc comes back and puts pressure on that nerve root. It can be things like central canal stenosis, where that nerve that comes through, or your spine that comes through that tunnel towards the back of your spine, that can start to get smaller. That's what stenosis means. And that can happen from degenerative changes, that can happen from a traumatic issue, that can happen from fractures or breaks, things that cause these vertebrae to slip forward. So all of those different issues are things that can cause sciatica or symptoms at the nerve root reproducing that sciatica pain. When we look at patients with SI joint dysfunction, these joints, neither one of them moves very much, but they're responsible for transmitting all of the force from the legs up into the rest of the body. And so if these joints aren't stable enough and transmitting that force properly, when that sciatic nerve passes over top of it, there can be inflammation in that area. When we look at your deeper glute muscles, most of us know our glute max or our glute med. There are a couple of different muscles there. But there's also a lot of really small stabilizing muscles that run through here. And an impingement in any one of those muscles or a muscle spasm or things like that can create issues that'll happen and then reproduce that same sciatica type stuff. Now, sciatica oftentimes happen as we get older, and sometimes it's from degenerative changes. What I would argue is more that it's this accumulation of stress or different stressors that you're putting on your body, not just the age. We've all seen healthy 70-year-olds, and we've also seen people who are in their 40s look like they're in their 80s, right? And so it's more of this accumulation of trauma and how you're moving and functioning and handling those things on a day-to-day basis. Now, we have a ton of different ways to first diagnose this, right? And so we go through a full orthopedic exam, we go through neurologic exams, we go through a consultation to make sure that you're telling us everything that we can find in your history that could be affecting your issues today. So we'll go through all of that stuff together. We can take x-rays if we need to. We've got lots of different tools in our tool belt. When we start to treat, every patient's going to get their own individualized care plan, meaning that yours could look different from the next person's because the causes or the severity of your issues may be a little bit different. And so the bread and butter, what we're going to do to treat these things are going to be adjustments. That's where we're going to get those joints to move again, trying to open that space back up, getting the pressure off the nerves. And that's going to allow your body to heal and function like it's supposed to and made to. On top of those adjustments, we also do rehabilitation exercises so that we can make sure that you are strengthening and stabilizing the right muscles through those patterns. We also have things like laser, which works really, really well. Laser is going to be a deep tissue infrared light therapy, and that light's going to drive the healing process up in the tissues that actually need it, like the disc or the nerve. We can also use shockwave. When we talk about those tight muscles, that shockwave is going to be responsible for breaking down those tight muscles. So we've got lots of different tools in our tool bag to put together for your plan to make sure that we're treating that appropriately. So lots of things that we can go through and try and diagnose, and then lots of different things that we can throw at it to make sure that it is feeling and functioning the way that it should again, right? And so sciatica, like I said, super common. Most people struggle with this at some point in their life. If you've got questions about your sciatica or a loved one's sciatica, come on in. Let's chat about it.